So I'm a pharmacist. I'm interested in prescribing and medicines, and when people use multiple medicines, it's called polypharmacy. And if we were wanting to access prescribing information, I would have to have an agreement with every single GP in the region, all of the hospital trusts individually. So I think really that's just not practical. So that would mean if I was interested in doing that kind of study, it would just take too long to actually do it properly. I think trying to access data can literally take years. Actually, you could spend the majority of a study just trying to navigate the governance processes, and that can be really frustrating from a research perspective, but it can also be expensive as well. So I think with the SDE, what we could do is we can go through that central process that they will have an agreement with all different providers or different people that have the data, that hold the data. So I could go through one process to access that data to help me ultimately do research to improve the care of patients. There's certain studies that are just not possible to do, not because we don't have the skills to do them, it's just because we just don't have the data. So again, through the SDE, hopefully that will prevent that, so we can design some really nice, exciting studies. We need to do research that is important to patients, so we don't want to do research just for the sake of doing it. We want to really be driven by the questions that are important to patients and the general public, and to answer those questions we need access to their data.